All right, so we're gonna go through the prone series. So again, this is starting on your stomach, and it's a progression up to being more extended through your low back. But throughout the whole thing, we're always gonna do what's the most comfortable for you or what decreases symptoms going down your leg and trying to centralize those symptoms towards your back. So your first position is just flat on your stomach. If you can lay flat, whether it's on the ground, the bed, doesn't matter, and this is comfortable and aids with your symptoms, we're gonna stay there. If even this is uncomfortable, what you're going to do is take a pillow and put it under your midsection so that it would just barely raise you up off of the table in order to provide a little bit of bend through your mid-back area. So we start here. We might lay for 2, 3, 4, 5 minutes. Doesn't really matter. As long as it feels good, you can lay up to 15 minutes. And then throughout time, it might be a couple days, it might be a week, we're going to progress this extension position up into a on our elbows position, and we can kind of be in a low elbows position, or we can really stack our elbows and get higher, or like a high elbows position. Again, whatever feels good, and it might be here for a couple of days before we move up into this position. Once again, I want to be here for 2 to 15 minutes, depending on how good it feels. And what we're really looking for is centralizing those symptoms towards your low back, not having those symptoms go further down one of your legs or get significantly worse but stay the same. So from here, what the next progression would be is we start to do kind of some seal push-ups. And all we're going to do is push up, hold for about 3 to 6 seconds, kind of whatever's really comfortable. Slowly come back down. You can come back down and rest in that high elbows or totally flat. And we might do 5 to 10 of these, holding for a couple of seconds. And then when we're done, rest in either your flat or your high elbows position. Again, completing that total 2 to 15 minutes. You can do a couple sets of these again if it feels good and continues to centralize your symptoms.